welcome everybody to the 5th InnovateWork Virtual Summit. I'm Bill Banham. I'm one of the co-founders of the InnovateWork series. This is the first one that we're doing for a UK-focused audience, and we've got some awesome thought leaders based in the UK today. Just to tell you a little bit about the background of InnovateWork. So I'm Bill Banham, founder of the HR Gazette and co-founder of InnovateWork with an awesome guy called Rob Catalano. We started the event series back at the beginning of 2017. And it's slowly grown into a bit of a global community now, actually, which is pretty awesome. The event series started in Toronto. The first event we did had about 75 people, and it grew. And we do a couple of summits there in Toronto, which get around 350 to 375 HR and talent and tech professionals turning up for those. And then last year we took it across Canada, and this year we've taken it to places in Australia and today in the UK, and we've got plans to take it to the US, the Caribbean, and elsewhere as well. The first session we have today is with Gethin Naden, who is Director of Employee Wellbeing at Benefex. And then after that, we're going to hear from Dr. Adrian Heisler, who's Chief Medical Officer at Helix International. Then it's up with Ryan Thomasvi. I think I got that right this time, Ryan. Director of People Science at Hive. And our final presentation today is going to be from Andy Britt, who's Vice President at IBM Global Business Services. And I'm going to pass over to Gethin.
Okay, perfect. Excellent. So what I'm going to talk about today, the coronavirus experience has affected us all differently. So there's this great quote that's been going around on social media about we're all in the same storm, but we're in different boats. And I think we need to be able to deliver the best employee and wellbeing experiences. And to be able to do that, we must start to personalize them. We know that not everyone is having the same life experience. So we've got to stop treating people the same. And the return to work following lockdown is going to see a hell of a lot more anxiety and poorer mental health. So it's never been more important for us to design experience for the needs of each individual employee. Just before we kind of get started, a little bit about me. I wrote a lot about HR and wellbeing for lots of different magazines and kind of consumer news as well. I'm the co-chair and a founding member of the Engage Success Thought Action Group on Wellbeing. That's a group of experts come together to help UK organisations develop better wellbeing strategies. I'm also the founding member of the Initiative for Financial Wellbeing and listed as an employee experience expert by lots of different organisations. Last year, I also won the Global Employee Engagement Influencer Award, so one of the top 100 global employee engagement influencers. And I wrote a book called A Word of Good, which went on to the Amazon HR bestseller list in the UK and went on to win an award as well. And this is really where I started to look at employee experience design and how important that was. And actually, I narrowed that down to well-being as an incredibly important part of that experience. And so that's really where my focus is at the moment, is the broad employee experience and how well-being plays a significant part of that. And if anyone wants to contact me on kind of social media following this event, I'll pick a few of you out and send some copies of the book to you if you're interested in that. And so one of the things I wanted to talk about before we kind of get started, and appreciate I've got a very short amount of time to kind of go through this, and this is usually an hour-long presentation. So if I skip over some things and you want a bit more information, you can find me or Benefex online and just ask us those questions, and we'll give you the answers to those. Whenever we have an experience at work, we are designing that, and I think what we need to get HR and organisation to think about is how we are designing our experiences. Experiences are critical to how we view work because they determine how fondly we recall things. So, for example, was my time at work a positive or a frustrating experience? And we see this quite a lot with things like onboarding, where we create some awful experiences by letting anxious employees wait for weeks on end before we hear back from them after an interview, that kind of stuff. And generally, from my experience, as an example, the whole interview process is really badly designed. People turn up in clothes they don't usually wear, or they act a way they wouldn't be expected to wear, and they kind of deliver rehearsed stories of customer service, etc. And so I think that's, there's some really good examples of bad design when it comes to employee experiences. But we've also one of the fundamental rules of the good design is we need to think about how people use it, and we need to make sure that the experiences we have at work are easy to use. Good design is intuitive. We can expect things to work a certain way. So in product design, things like doors with a handle open towards us, steering wheel spin to the right. So there's a natural order of things we expect things to work. And whenever we think about good design at work, it's generally brilliant in its simplicity. As humans, we shy away from complex design, so we don't like to have to think too much. This is called natural mapping, and it's about alleviating the cognitive load that somebody has when they use things like technology, for example, so the technology we use at work. So, for example, things like we expect the green button to symbolize yes or enter or go, and a red to indicate stop or cancel. So as well as ensuring we understand that there's a human at the end of the experience, we also need to ensure that our experiences at work are meaningful. And sometimes this means we need to be honest with ourselves about the frustrations that employees are facing and get to the bottom of what those employees really want from those experiences. And there's a great story about Harvard professor Theodore Levitt, who famously once said that people don't want to buy a quarter-inch drill, they want to make a quarter-inch hole. But in reality, we can probably dig a bit deeper into that and see that if the hole in the wall is required for a shelf to hold books, then the real problem in this example is that we've got nowhere to put our books. So good designers don't try to solve the problem given to them. They start to try and understand what the real issues are. And you've probably heard of this called design thinking. And it's an easy way for HR to apply it to developing employee experience and well-being strategies and ask themselves lots of questions about, what are we actually trying to do? And a really good way of doing that is asking yourself 5 questions as to why are we doing this? So when you're rolling out a well-being initiative, why are we doing this? Why do we think this will be a good thing, and all that kind of stuff? And at Benefex, we talk about this generally as employee experience loops. So designed by our CEO, Matt Macriola, we think about those small interactions we have at work as being the loops, and kind of looking at those small or big loops, collectively you start to improve the employee experience. And so the example we see on screen is kind of a conversation somebody had online with Google, where you ask Google to remember this location. They said, okay, I remember that. Then when you ask it again, what did you ask it to remember? It just remembers, you told me this location. Kind of really frustrating experience. And technology dominates our employee experience at work, and it's dominating the well-being experience. And so when we think about technology design, we're starting to think about how easy is it for us to use? How frustrated do we get when it doesn't work the way we expect it to? And I'm sure we all experience this with our smart speakers at this moment while we're in the kind of early stages of development, that kind of product. And what we tend to see with technology is this kind of paradox of technology, as it's called, where providers will add feature after feature to kind of justify the cost of technology. But actually what you start to see is that actually convolutes the whole process and makes it more difficult to use. And what we can see in the workplace is, people use so many bits of experience now, and we're starting to see well-being become part of that experience, that you're just starting to kind of really overload people. And so we've got, as an industry, as a HR technology industry, we've been really guilty to add to the overload that employees are facing in the employee experience, and now are facing the same thing in employee experience, employee well-being experience. We've met clients in the past couple of months who've had crazy amounts of systems. So we had one client recently with about 22,000 employees in 4 countries. They had 1 email system, 4 collaboration platforms, 3 chat platforms, and they were now looking at what bits of well-being and mindfulness technology and occupational health they could start adding to that. So what we found is immediately for their employees just to do their job, they have to access more than 7 different platforms. And as we start to dig into that a bit deeper, we can start to see that actually that overload is even worse. So we can see that we have systems for payroll, reward and benefits, perks, shares, time and attendance, onboarding. And some research we did a couple of years ago at Benefex found that the average figure is about 28 different systems to be able to do the job, and half of those are in HR. And it's almost like, we talked about Netflix at the start of this call. Imagine if Netflix didn't suggest content to you and instead just gave you a list of the thousands of films they've got. Or imagine if you had to log into separate systems if you wanted to view films from Disney or Universal or Paramount. We just wouldn't do it. We make that so difficult. And we know from consumer research that even asking a consumer to create an online account sees 30% of people abandon their shopping carts. So those small little barriers we're putting in the way are reducing our ability to have a great experience, but also our ability to want to use things like the new bits of wellbeing technology. So we've kind of got to find a better way to reach people and grab their attention. And I think we can do that by designing things better and how we surface that information to employees. And what you can see on the screen at the moment, these are just some of the logos that you'll see in the UK at the moment as wellbeing emerges as that significant part of the employee experience. So what we're starting to see is we've got this whole new load of wellbeing kind of overload that we're throwing on top of what people are already experiencing. And one of the primary things we discovered in our research with King's College London and my involvement in the EFS Wellbeing Thought Action Group was that employers and employees are really confused by everything we're throwing at them. And so it's really important when you think about wellbeing at work and employee experience that we aren't continually just adding by throwing multiple bits of technology without thinking about how these things work together. We really need to think about the fatigue involved in accessing multiple systems. And it's a big problem, and it sees a lot of investment wasted. So I think that's a really important part of the experience for us to think about at the moment. And when we think about well-being in the employee experience, what we're starting to see is these really rapidly changing attitudes to well-being in the workplace. So some of the headlines that have kind of hit their headlines in the UK, in particular over the last few months pre-coronavirus, we started to see that well-being was going to become this really big priority for CEOs and HR teams right across the country. We even saw politicians and mayoral candidates being urged to prioritise workers' health and well-being. And you've probably seen some other examples in the news as well, where governments are now starting to look at, actually, is GDP a really good way of us measuring how successful a country is? And should we be looking at the individual's well-being? And actually, should that be a guiding milestone for what we do? And the UK has been looking at that. We know New Zealand's kind of leading the charge on that. But as we start to kind of get into this new area of well-being, and we are still really in its infancy, we're starting to see quite a few challenges. And last year, a study published in JAMA, a medical journal in the US, looked at the experiences of 33,000 workers at BJ's Wholesale Club, a retailer in the US, over a year and a half, one of the biggest workplace wellbeing studies ever taken place. And while workers who are enrolled in the wellness program reported that they'd learned to exercise more and watch their weight, the research found that there were actually no significant differences in outcomes like lower blood pressure, or sugar levels, or other health measures. And it found no significant reduction in workers' healthcare costs, which is obviously a big reason behind workplace wellbeing in the US in particular. And that study randomly assigned employees to a wellness program and compared their results to those people who were not enrolled in such efforts. But one thing they did find is that some disengaged employees had started to take the first and important steps towards looking at improving their own wellbeing. Employees have frequently recorded that, saying they feel pressurized by their employer to take part in wellbeing, and that it's not being well received is a reason why they don't get involved in workplace wellbeing. And the research has actually found that employers would see the most benefit from trying to change behavior rather than focus entirely on reducing health spend. And I think that's something really important for us to think about. Another big study about workplace wellbeing that came out last year was by the University of Chicago. Public policy associate professor, a gentleman called Damon Jones, along with the University of Illinois faculty members, designed this workplace wellbeing study. And they randomized 12,500 individuals, divided them into control group and treatment group. And they found that virtually no difference in health spend between the control group and the treatment group. There was no significant difference in sick leave. There was no significant difference in salary or job separation. And in fact, gym visits were nearly identical between the two groups, and there was no real difference in any kind of running clubs or participation in running events. And all that data we gathered kind of across those two really big studies that came out in the US last year, they kind of tell us that most workplace wellbeing fails because it's not designed for the right person. Most workplace wellbeing initiatives fail because they're designed for the workplace, not the worker. So two of the biggest workplace wellbeing studies we've ever seen tell us largely the same thing, that we must design wellbeing for the employee, not for the employer. And that kind of takes me on to my final point, and that is, how do we do that? How do we design for an audience of one? As consumers, we expect a personalized experience at work. We get that from Amazon and Netflix and LinkedIn. Those of you who are on the call that have ever designed a product or a customer journey will be familiar with the idea of designing for a target audience. And that's easy when you're building a product aimed at a specific demographic, such as teenagers or new parents. But it's much more difficult when we're designing for experiences for a diverse workforce full of different genders, races, ages, cultural backgrounds, different educations, different motivations, etc. So we don't have a target consumer within our workforce, which means the experiences we deliver shouldn't be inherently personalized to that individual. And after all, there's no such thing as an average employee. If you kind of look at an average employee and you averaged out left-handers and right-handers, what do you end up with? Averages don't really work. And so personalizing that employee experience is really, really important part of how do we create better well-being in the workplace. And as employers, I think we've got to the point where we believe that the fair thing to do is to treat everybody the same, but employees are different. They have different needs and wants and need different support. We've seen during coronavirus that not employees are being affected the same way. In the UK, 1 in 8 people don't have gardens. Some people don't have safe homes. Others have swimming pools and lots of room. You are significantly more likely to not have an outdoor space if you are a Black employee or a person of colour. And so you think about what's going on in the world and how we're trying to change ourselves to become more anti-racist. We need to really think about how we design well-being experiences for everybody rather than just an average employee. And for a long time in employee benefits, we made sweeping assumptions about what different generations wanted from a benefit scheme, for example. So we assumed that employees' lives they followed a set cycle of marriage, starting a family, retirement, when in reality there are fewer marriages and births than we've ever had before, and people are working for longer and working into retirement lives. They're starting families later in life, and many are delaying house buying till their kind of 30s and 40s. So demographics and personas are out the window, and we can't design workplace experiences for groups of people anymore. We have to view our audience as one person. So it's become incredibly useful for us to design employee and wellbeing experiences with that design thinking in mind. And that enables us to embrace our employees' beliefs, trust and belonging that they have in their workplace. And that design thinking helps us to identify small loops of frustration and annoyances that can be quickly resolved to create more positive experiences at work. And I think this thinking also helps us make sure that any technology that we're purchasing, whether that be for the employee experience or well-being, is going to achieve what we want it to achieve and ultimately deliver meaningful experiences for our employees. So appreciate that's a very whistle-stop tour through kind of design thinking and design those employee experiences. But I think as we start to get our employees to go back to work, we must learn from what's happened over the last 3 months. And we've realized more than ever that the individual circumstances a person has and how much their well-being relies on those circumstances means we have to design those experiences for the individuals and stop looking at averages and a wider group. So I'm now going to pass over to our next speaker, Dr. Adrian Heisler, Chief Medical Officer at Helix International. And Adrian will be talking about COVID-19 and the medical considerations in returning to work.
That's great. Thank you, Gethin. That was very interesting. And I'm sure I can find a use for that duck slide. I thought that's fantastic and some great concepts. Right. So, as I said, thanks very much, Gethin. My name is Adrian Heisler, Chief Medical Officer at Helix. We're a company that provides medical and security assistance to governments, the UK Foreign Office, New Zealand, NGOs like Oxfam, Save the Children, and companies like General Electric, media organisations, BBC, and other such things all over the world. Anyway, all we've been doing for the last few months is talking and working on COVID-19, which I'm going to try and give you a little tour through what we know about the virus and how that affects getting people back to work. So again, it's whistle stop, like Gethin said, but I'll try and get in as much useful information as I can for you all. SARS-CoV-2, that's the name of the virus, and it causes the disease, which we all know as COVID-19. So this is a coronavirus that was first alerted to the world at the end of December from the city of Wuhan in China, and it joins 6 other coronaviruses that cause human disease. There are 4 that cause common colds, and there's the SARS virus, which was an epidemic in 2002 to 3, but has now been eradicated, and MERS, which is still ongoing. That was around 2012 in the Middle East. All respiratory illnesses, but this is by far the nastiest, the most virulent, and the most significant. And as we know, it's a respiratory infection. It affects your upper airways, lower airways, lungs, and as we now know, all organs in the body. It spreads through droplets from talking, from coughing, sneezing, and just from breathing. And the only way we can actually prevent other people getting it is to keep away from them. So if we're not well, we self-isolate, we keep a distance from people, whether it's 1 or 2 meters in different countries, or 6.5 feet. And we try and keep the virus off our hands with washing and alcohol rubs. We know that if you become infected, it takes usually about 5 or 6 days before you display symptoms. And it can be a couple of days, it can be up to 11, 12 days, but generally it's 5 to 6 days. And we also know that you're most infectious on that first day of symptoms. You're also infectious for a couple of days before, so you're asymptomatic, you've got no symptoms, but you're still infectious. And then for a number of days afterwards, that seems to be around sort of 5 to 7 days where you're still infectious, you're usually getting some symptoms. A number of cases have no symptoms at all. So that could be 40% of the population who get the virus don't know they've even had it. And it could be up to 80%. We really don't know what the number is. But certainly CDC in the States are looking at 40% of don't get any symptoms. If you were to get symptoms, 80% of you will get just mild symptoms that won't need to go to hospital. You'll stay home, you'll get better, and you'll be fine. 5% are severe. And we think now, with figures getting more and more, that between 0.2 and 0.9, so that's 2 in 1,000 to 9 in 1,000 people will unfortunately die from this disease. The confirmation, the diagnosis is by those swabs that go right to the back of your nose, back of your throat, not very pleasant, and then a lab test that takes a few hours in the laboratory. And as we also know, that there's no absolute treatment, and there is no vaccine currently, though there are about 25 vaccines being developed, hopefully. Just a little bit about the vaccine, the virus, just to get a few points across. So we know that this is circulates in the bat community. There are thousands of coronaviruses within bats, but only 7 have made it into humans. What happens is the bats pass the virus to an intermediate animal. We're not sure what it is. Speculation about pangolin, that scaled mammal. And then there's a spillover event. That means the virus comes out of the animal world and passes to humans. And then the important part of that is the mutation that makes human to human transmission. And that's where it becomes a major event, if an epidemic, eventually a pandemic in this case. What's important about the virus is that it's very simple. It's got a lipid layer. This is the envelope. This is what surrounds all the RNA, the part of the virus that changes your cells. This is the spike protein you might have heard about, and this is kind of the key that unlocks the way into human cells. So if we can get rid of this lipid envelope, the virus is inactive because it doesn't have these spikes to get into cells. This virus can only survive in human cells, in animal cells, whatever the animal is, bats, the transmission animal, and humans. And what happens when it gets inside is that this RNA takes over the cell's mechanisms, the machinery, and produces lots of copies of itself, which then go out into your respiratory tract, invade the body, and leaves the cell dead. So, as I said, the way we overcome the virus is to stop the virus transmitting from one human to another, and then it goes away. But that's hard to do. It's called an obligate intracellular parasite. Obligate meaning it must be within the cell, intracellular, and it's a parasite. It takes over the cell and destroys it. So how we're doing that, as I'm sure we all know, self-isolation. If you're unwell, you stay in, you stay away from other people so you can't transmit it. There's now a lot of test, track, trace, isolate for all contacts going on in countries that are over that peak. And obviously things like maintaining physical distance, whether it's 1 meter, 2 meters, whatever it is in your country, 3 feet, 6.5 feet, and then washing your hands with soap and water, which destroys that lipid envelope very quickly, 20 seconds and it's gone. And that's how simple it is to stop you transmitting it from surfaces to your nose, mouth, eyes. And the only way that we're going to come to an end of this is either if we can treat the disease. So if we get a treatment and you either don't get the disease, you get a less severe version, or it actually cures you if you've got it, then that's the end, because we'll make that available. But that doesn't seem to be forthcoming at the moment. And so the other sort of definitive answer is a vaccine, or a number of vaccines more likely, that are cheap, that are effective, so they give you good immunity, that don't cause side effects, and also that we can produce at scale and pass to most of the world. And we're talking sort of 5, 6, 7 billion people have to get this vaccine. Testing is a bit controversial at the moment because there are two basic kind of tests. There's a diagnostic test, which is, as I said, the swab that goes back of your nose, back of your throat. The problem with that is that you've got to get a good swab. If you don't swab the virus, you won't get it to the lab. Once you get that sample to the lab, if it's there, you've got a very good pickup. But if the swab doesn't pick up virus, if it's not done deep enough, the virus doesn't happen to be in that area, you'll get a false negative. And so you may have the virus, but you're told you don't have it. And that's quite dangerous. What we're advancing towards now is saliva tests. So these are being brought in. And so you're spitting into a vial, passing that on to another testing mechanism in the laboratory. And that's much more accurate because you've got spit there. You're not having to swab the right amount. So those are coming in. You can do them at home. The other kind of test is what you've probably heard of as an antibody test. Now, these are not at the moment recommended for individuals. These are surveillance tests for government, so they can find out what the prevalence is of the virus in the country. So you can say, we've got 5% people have been infected in the UK, say, or 17% in London, 20% in New York. This is through antibody tests. But these are not accurate, especially in a pinprick point, the pinprick home test strips. They've been withdrawn in the US and the UK at the moment, pending further tests. And they're not worth it. If you've got one, it's not really going to tell you much. Because basically, we don't know which antibodies it's picking up, whether they're neutralizing, whether they're actually destroying the virus. We don't know how long they last. So, you may have antibodies now, you might not have them in a couple of weeks' time. So the idea of immunity passports is something that we're not thinking about at the moment. As to something that is being adopted by a number of companies that, without necessarily calling it this system, the 10-4 system, that's this Weizmann Institute of Science in Tel Aviv, in cooperation with the London School of Economics, they've come out with a system that, like I said, a number of people are using, which is splitting the workforce into two groups. And these groups work in 2 cycles. So what happens is that the first group, let's call them the blue group, will work for 4 days, the equivalent of a 5-day week, so maybe longer hours. And then they'll have 10 days off. And then the second group will do, again, say Monday to Thursday, and that's their week. So you're keeping the workforce working. They're working half the time they would have done before, perhaps, but at least you're not having massive layoffs. They're working half their hours. But what happens is that if someone comes to work and then there's some transmission at work, by the time they're off work, that's when they'll start to be developing any kind of infectivity. So say their symptoms appear at 5 to 6 days, they'll be at home, they're able to self-isolate at home. Most of them, as we said, will either have no symptoms or have very mild symptoms. And by the time they're back at work in 10 days' time, those symptoms will have gone away and they'll be able to go back to work. This can also, as we get better testing, we'll be able to get to a point where they could maybe be tested on a rapid test that we're getting nearer to, that will take 2, 5, 20 minutes to get a test at home, and then we'll be able to see if people are infected then. This is being used in Austria for schools. For the last 3 weeks, they've been trialing this, and a number of companies in Israel are trying it, and they're putting it forward to a number of companies around the world. It's a lot of what a lot of people are doing, but it's there in a protocol. Now I'm running short of time. I appreciate that. I've just put a few thoughts there on how companies can get people back to work. They're all things that I think you'll be doing. It's hazard assessment before people go back to work. Explain to employees what's going to happen when they're at work, so they get more confidence about going back to work. Possibly testing before they go back to work. At the moment, more likely to be doing some kind of screening, whether it's on symptoms or on temperature. And then when they get to work, it's all measures to distance them, measures to disinfect the workplace, to give them hygiene capabilities. And also, in some places, lanyards, they're using wristbands that will tell you if you're within 6 feet of someone. So it gives you a reminder that you need to stay away from people. Obviously, ventilation systems are very important, filtration of air. And then also, as Gethin was saying, the well-being of people at work and giving them emotional support, practical support, explaining that they will get paid if they have to stay off work because of COVID-19, and then having regular feedback opportunities for people. It's been shown by the Diabetes UK that 67% of diabetics are not confident to go back to work. They're feeling unsafe there, and at least half of those aren't able to explain that to people. So there are certain groups you need to look out for. A final thought: these things do go away in the end. They've all ended finally, but in the meantime, we are just preparing, we're planning, we're making sure that everything's in place to bring these, to look after people while we get to the point where we can sort out this virus. And that, unfortunately, is still the case for the world. I'll now pass on to Ryan Thomasvi, who's an occupational psychologist and the Director of People Science at Hive. So over to you, Ryan.
Thanks everyone for joining in. As Adrian mentioned, my name is Ryan Thomasvi. I'm the Director of People Science at Hive HR and an occupational psychologist by background, and I partner with organisations to help them measure and improve employee engagement, organisational culture, and to support them with how they approach and manage organisational change. And very similar to Geth and I'm really passionate around the idea that people deserve to have good days at work. They deserve to have positive experiences and be healthy and thriving at work. And of course, we're living in times at the moment which are undoubtedly having a profound impact on how people are experiencing work and on their health and well-being as well. And what I'd like to talk about today is I'd like to explore the kind of apparent dichotomy between organisations that are still seeing their employees and employee voice as being hugely important and critical to how they respond to this crisis and manage their way through this crisis. And those organisations that are perhaps seeing employee voice, employee surveys as being something that's an unnecessary drain on resource or a cost that they can remove or just a distraction during these times. So I'm going to spend the next few minutes to unpick where employee voice fits and why it matters so much during this time and the role that it can play in crisis management. So the first part of any crisis, in terms of our response to it, is one where you look to your leaders to demonstrate that strength of leadership, to demonstrate that authoritative approach, and to really kind of direct and communicate to the organization around what that response is going to be and how it's going to help navigate the organization through the crisis. And I use this visual here because if you were to imagine that you're on an aeroplane and the pilot comes over the tannoy and informs you that there's something wrong with one of the engines, or informs you that there's something wrong with any other aspect of the plane. If he then proceeded to ask the passengers what they believed that he should do about it, we would all sit there in panic. We would kind of look to one another, and we would expect the pilot to use his experience and his skills and his specialism to kind of step up and be really authoritative and kind of handle that crisis and react to it immediately. And it's absolutely the same with businesses and our response to this. This is something which was thrust upon us quite quickly in terms of the coronavirus pandemic. It was something which organizations had to respond to really quickly, and certainly not something which many organizations, if any, were well prepared for. So absolutely, in that first instance, employees will have been looking to their senior leaders to really demonstrate that strong leadership and really communicate exactly what the organization was going to do to respond to it, to keep people safe and well, to try and keep people in their jobs, to enable people to work from home, and what their business strategy was going to be, and how they were going to flex and adapt that business strategy to help successfully get through to the other side without too much of a negative impact. So the onus there is on the leaders and the work that they do, but also on how they communicate it to people and making sure that people have that clarity and they're able to understand exactly how the pandemic is going to impact the business, but also them as individuals, and also the way in which that communication is delivered to them. It needs to be delivered to them with honesty, with transparency, but critically with empathy as well. That's hugely important in terms of how we approach this. So at this point, you can of course, you can understand organizations taking that type of response and perhaps not asking employees for their suggestions or their views on how the organization should respond to coronavirus in the immediate short term. However, employee voice is massively important, and we need to understand how the changes have impacted on people's health and well-being, how this has impacted on their day-to-day experiences of work, how they are able to continue performing, whether they're on the front line in a factory or whether they are working from home, and taken into consideration all of those other different factors that'll be influencing people, things like childcare responsibilities and other things such as that. So giving employees a voice is absolutely critical as you go into kind of phase 2. You've done the initial response, and now you're looking at how can we kind of understand the impact this has had on people? How can we make sure that these new ways of working are actually enabling people to perform effectively in their roles? And then, of course, how can we start preparing for the future and shaping the future of work for our organizations? So including employees, giving them the opportunity to have their say, gives them the opportunity to open up and express their feelings. It gives people the opportunity to express and share any underlying uncertainties they have, any anxieties they have, as well as sharing their thoughts and opinions on how the crisis is currently being handled, how well they believe the communications have been handled and approached, how impactful they've been. It's a great way for employers to understand how well they've done and delivered that first phase of the crisis response, and to understand what more they need to do to enable their employees to continue working and being effective during this crisis and the current situation. We also really see employees kind of needing that need to feel in more control. We know that uncertainty is one of the worst things for the human brain from a neuroscience perspective. So anything we can do to give employees the feeling that they are able to exert some influence and that they're able to have an element of control over what's happening to them and to their teams and to the organization is going to be hugely impactful. So we want to give employees the opportunity to put forward suggestions and ideas of what we can do as organizations to improve things like remote working, to make it work for those who've suddenly been thrust into that particular environment. For those who are working on the front line, what can we do to make it safer? What can we do to improve it? And also, as we start to look for returning people to the workplace, bringing people back into work, what can we do to make sure that we're going to be able to tailor that return to work plan to suit the individual needs of people? And what can we do, and what can we perhaps change as a business that is going to make that employee experience even better than it was before this pandemic hit us? And finally, as well, recognition is something that absolutely cannot be lost during this time. It's something which can continue to build that sense of belonging, that sense of connection, and it can also really help to build that kind of sense of hope and optimism during this time if we're able to continue getting those thank yous and well dones and those really impactful bits of praise, not just from managers, but from colleagues and from senior leaders as well, to recognize that we're all absolutely trying to do our best to help our employees and help our businesses and our teams kind of pull through this and get through to the other side as unscathed as we possibly can. So it's so important to continue giving employees the platform in which they can continue to do those things. And what we've noticed at Hive through the work we've been doing with lots of our customers is the impact that that's actually having on employee perception of the organization. And so I'm going to share some of that data and insight with you. So what we're seeing from organizations that are continuing to survey and that are continuing to prioritize employee voice during this time, we're seeing a huge increase in response rates of 15% on average across our surveys compared to surveys run pre-COVID. And to me, that makes perfect sense, because we always say to organizations that people want to give feedback. People always want to give feedback, but they want to give feedback on things that resonate with them and that really feel relevant to them. So making sure that those questions are really meaningful. And absolutely, at this moment in time, we're all being impacted by this personally and professionally. And so, of course, our employees want the opportunity to provide that feedback to you. So we're seeing that increase in response rates. We're also seeing a huge increase of 170% in employees leaving general suggestions. So that's using an always on kind of open door way of providing suggestions, whether they're general concerns, whether they're ideas for how we can improve in the future, or whether they're just general questions that people still feel like need to be answered, kind of being able to submit those and send those for an employer to be able to pick those up and respond to them and actually see what employees are feeling and suggesting is hugely impactful. And of course, what we're seeing here is that the key with this as well is open and transparency, as I mentioned. So the communication is absolutely critical. And what people are really looking for is openness and transparency. They want to know what's happening. And if you don't give people that clarity, what happens is they create their own stories and they jump to their own conclusions. And those stories which people create are often even worse than what the potential reality is. And, you know, we need that adult to adult communication. We can take, as individuals, as human beings, we can hear bad news. As long as it is communicated, as I mentioned, with empathy and with transparency. And I've got some examples here. One organization we work with that had to introduce a 25% pay cut right across the entire business, as well as making around 40% of the business, 40% of employees take furlough. When they ran a survey, 88% of people responded favorably when asked whether they understood the decisions that had been made. And when they were given the opportunity to explore that further through free text, they were talking about the way in which they were communicated to and the way in which they were consulted and included in conversations around those decisions, so that they really understood why those decisions needed to be made by the business and how it was going to be critical to a long-term sustainable future for that organization. We had another organization that had to make huge numbers of redundancies. And even in spite of that, 94% of their employees were proud of how the organization has responded to the crisis and how they've handled it. And again, it was because the communication was two-way, it was really honest and open, and people were given the opportunity to feedback on how they were impacted and to ask questions and to explore anything which they didn't understand further. And they were really getting that opportunity to do that by the senior leaders and the executives of that particular organization. And finally, from an employee net promoter score perspective, so that's when we ask individuals whether they would be likely to recommend our organization as a good place to work. For those organizations that are continuing to ask that question and getting an idea of levels of advocacy in the organization, we've seen an average 23-point increase in employee net promoter score compared to surveys delivered pre-COVID. And that just goes to show the importance of employee voice at the moment in terms of bringing people together. So even if the news is bad, even if it's having a negative impact on our people, on our businesses, the way in which organizations are kind of coming together, giving their employees a voice, is actually leading to them kind of being more inspired by the organization and actually seeing the organization as actually being truly people first, and therefore they are indicating a willingness to advocate that organization as a good place to work. So absolutely critical that we don't see that just because we're in the middle of a crisis, this is a time to be overly autocratic in terms of our response and our management of this crisis and putting employee voice to one side. It's not the case at all. We need to put our employees kind of front and center of this and to make sure we're communicating with them and we're keeping them on board. And when we're doing that, when we're communicating with them, when we're giving them the opportunity to have their voice, we can see the impact that that's having on their perception of the organization. And I feel very confident that organizations that are doing this, they're going to have people who are going to want to fight tooth and nail to help their organization get through to the other side of this. And they're going to be more engaged and they're going to be more likely to stay with that particular organization for the long term to really help that organization continue to grow and reestablish its success in the future. And just a final image to kind of summarize that is that when I saw this image, it really made me think about organizations at the moment with the amount of ambiguity and the amount of uncertainty that we're faced with at the moment. This idea that, we're all trying to find the right path. We're trying to find the right way to return to work and the right way to shape the future of work for our organizations in a way that means our businesses can continue to survive and then thrive. But I would feel much more confident as an employer, as an organization, in finding the right path if we are to include all of our employees in this and to give them the opportunity to have their say and to help guide us You know, we know that our employees can often come up with the greatest ideas and the greatest of suggestions. So why not give them an opportunity to help guide us and help us find the right path as we all look to try and get through this crisis and to return to whatever the new normal looks like as we get through this. So I hope that's given you a bit of an idea of why we feel the continuing to speak to your people is so vital. It's so critical at this time. And please do and pop any questions for me if you'd like to unpick any of that and explore some of that a little bit further. Otherwise, thank you very much and stay safe. So that's it from me, and I will now hand over to the last speaker, who is Andy Britt. He's the Vice President of Global Business Services at IBM, and he leads their talent and transformation practice in Europe.
Thank you very much. I'm conscious actually as we start, I'm aware of some of the distressing, events we're seeing playing out in the US in terms of injustice and inequality. And I'm also painfully conscious that as a panel, we're not diverse or reflective of the employee bases that we serve. So I want to apologize for that. I know we need to do much better, all of us in leadership, and particularly those who speak on panels like this, to make sure that we represent the communities that we serve. I want to go fast. We've only got a few minutes. HR is in the eye of the storm. I mean, if the COVID-19 pandemic has taught us anything, is that business is all about people. And as the virus is destroying lives, jobs and industries, what we're also seeing is that the lockdown has transformed the way we work, communicate and innovate. So whether we're working from home with a laptop and broadband connection, as many of you are now, or we're on site with protective equipment and stringent distancing measures, every one of us is having to adapt to a very different normal. And I want to argue this is a real turning point for HR leadership. We've got to be at the heart of our organization's strategy and replanning activities. This is a forced and fast transition, and we're having to redesign the future of work and reimagine the future of the workplace. So it's a big topic for my remaining 8 minutes. So let me give you some data, an approach, and an example. Right, data. This is research from IBM's Institute of Business Value. We've been conducting this research over the last few months. First of all, 75% of executives say they are currently helping their employees learn to work in new ways. That sounds great, but look on the next one, on the right-hand side, only 38% of employees agree. So there is a gap that HR needs to address. We've got to help employees adapt to and feel comfortable with these new ways of working. According to HR Executive Online, 69% of the employees say this is the most stressful time of their career. You are not kidding. And then our research shows that about 40% of employees want their employer to provide employee opt-in remote work options when returning to normal. So organizations are going to have to reimagine and rebuild their workplaces on the assumption that virtual working will be part of the next normal. So that's the data. Here's the how. Now, because we haven't been here before, right? We've never had to redesign the return to work in a climate of such economic and health uncertainty where there still isn't a cure for the virus. And so we need to recognize that this is what the business schools define as an adaptive challenge, i.e. there's no playbook, there's no precedent, there's no best practice guide. It's a complex problem where we can't rely on past experience or lessons learned or call in a business guru to navigate the path for us. Now, when you are faced with an adaptive challenge, that's the technical term for a complex or wicked problem, one of the ways to approach it, and building on what Ryan is saying, is to give the problem back to the people. Now, that may sound counterintuitive, but just go with me. It means share it with your workforce. Ask for their views and ideas. As you evolve your plans, seek their feedback, gather their opinions. In essence, you need to tap into the collective intelligence of your employees to help you through this problem. And I think business leaders, however good pilots they are flying the plane, need to acknowledge that they can't solve this in the boardroom on their own. A top-down approach is unlikely to be effective. So you're going to have to learn your way through the next year, next 12 months, next 2 years by sharing those challenges with your people and getting feedback loops firing on all cylinders. How can you do this? Well, polling. I'm always surprised in the number of WebEx and Zoom calls that I participate in, and the hosts don't know how to use or set up a poll. This is a fantastic opportunity on every meeting to get everyone to express a view, whether it's in the chat, as I hope you're doing now, or in the polling. You can get some data that you can use. Jamming, a more structured approach, is to do an enterprise jam. At IBM, this is how we formulate our strategy. This is how we defined our values. And you invite literally all, in our case, 360,000 people, get online over 2 days. Here's what we're going to be talking about. Put in your views. We'll use data mining capability to surface the key themes. We'll do voting. And that way we'll synthesize everyone's thoughts and views down into a kind of coherent and consensus view of strategy. So use jamming. Or then thirdly, sensing and responding. Of course, the other thing you can do is use tone analysis, artificial intelligence to kind of read what everyone is currently blogging, saying in your online collaboration forums. And if you use kind of online collaboration tools in your organization, it's very easy to mine that data and pick out anxiety, negative sentiment, hotspots, trending themes, and you can use that to inform your policy. At IBM, interestingly, that was a way in which we informed some of our most recent HR policies, just by hearing what people felt about the current policies today. And finally, to refresh your culture. And this is an example. So context first, as far as the physical workplace is concerned, there you are, social distancing in the workplace, 2 meters apart, make sure you're wearing masks. HR is going to have to start thinking about these issues, logistics, health and safety, physical distancing, and also who's truly essential to the business, who actually needs to be in the office or on the factory floor. And this is now throwing up some really big challenges around fairness. As Gethin, I think, said at the start, we've got to account for wildly diverging circumstances such as family obligations, physical and mental health, and the availability of transport. And we might even, as HR professionals, have to rethink the concept of equality and instead build policies that are designed to meet the individual where they are. And some examples of good practice are coming up from all industries. My client, professional services firm EY, recently drafted some basic rules to make the workday more manageable for everyone, such as limiting meetings to 45 minutes and establishing a protected lunch break. And then I wanted to show you this. This is IBM's Working From Home pledge, which went viral for its gentle commitment to putting empathy at the heart. So just look at that. I pledge to be family first. I pledge to support flexibility. I pledge to support not camera ready times. How wonderful. Switch your cameras off if it's not proper. I pledge to be kind. Never heard that expressed in the workplace before. I pledge to set boundaries, take care of myself, frequently check in, and I pledge to be connected. I mean, just note, each of these statements have been worded as a means of empowerment, not control or policy mandate. Those organizations that are leading in this space are those with a high trust culture, those companies who are willing to trust their employees to remain engaged rather than track the hours that they put in. So, in closing, as one HR leader put it really well, COVID-19 is the critical moment your company culture is revealed. But I also think it's the moment where we can reshape, reframe, and revisit our company culture. Right, I know we're tight on time, so I will stop sharing. Bill, back to you.
Okay, thank you very much, everybody. That was fantastic. And now we are into the Q&A section of today. So I think we've got all of our panelists back. Adrian, if you can join us as well, please, sir. Because we're going to throw some hard-hitting questions at you now. I think John Ingham is ready and waiting with a couple of questions in there. There's been a bit of good dialogue there between him and Ryan. I've been seeing over the last few minutes. Just to get going, though, I've got a few questions for you guys based on what you were saying today. Gethin, for you first, if you don't mind. You spoke about the paradox of technology. What can be done to not overload employees right now then? How can HR jump in a bit more to help streamline the tools that employees are expected to use right now and prioritize what's important?
I think it's, first of all, let's acknowledge that technology will always be a big part of that employee experience. Just the way we live our lives, what we're doing now, we use technology every day. But I think, especially when it comes to employee well-being, lots of people are starting to look at a pillar of well-being around digital well-being. So knowing that, the Zoom fatigue that Andy was just talking about, it's a very real thing. So, all that fatigue and anxiety we faced over the last couple of months of using these kind of camera tools so much, that's having an effect on us that we haven't experienced before. The fact that most of our lives are dedicated to looking at one form of a screen or another. So I think it's just recognizing that we're trying to solve problems without creating new problems. So what's very easy to do in the wellbeing space, I think, at the moment, is to buy bits of technology. When you look at what affects people's well-being at work, lots of it is to do with, the purpose that I have, the values that I have. Do they match the organization? Do I have clear development? Do I feel cared for? What Andy said, actually, it's easy to kind of put something on your wall to say we care for employees, but it's a very different thing to actually do and actually act like you care and design with empathy, because that kind of stuff I think is really important. So I think it's just an acknowledgement that you can't just keep throwing tech at stuff without thinking about it. You've got to think about the experience that's having for the end employee. And to Andy's point, when you look at any good design, any good product design, or any design generally, empathy is a foundation of that. So it's understanding that if I'm going to give people one mindfulness app to download, and then an occupational app to download, and then a financial education tool to download, what effect is that having on people? Although the motivations are obviously really kind of pure to get those things in front of people, we need to think more about, we can't just throw technology at the problem every single time and expect it just to solve the well-being problem.
Okay, thank you. All of these questions, by the way, chaps, if you've got anything to add, please jump in at any point. I'd like to pose one now to Adrian. Do you think that we're being too relaxed, at least in England? There are different things happening in Wales and Northern Ireland, in Scotland, but do you think right now we're being a bit too relaxed, and because of that we might see a second wave?
A second surge, I think, is inevitable. I don't think there's any way that with the virus out there, just as it was before we went into lockdown, that the virus has gone away. It hasn't. And the prevalence in this country is about 5%, which is echoed in France, in Spain and Italy, generally in the countries. Obviously, centres have got higher prevalence, like London, 17%, like I said. But we're coming into the same world with the same virus and the same transmissibility. So as soon as we start interacting, we've learned what we have to do. But I've noticed, I live in Brighton by the sea, and I've noticed that people are just gathering as they were before, and people have had enough. And I think that was one of the things the government said initially, that people would get tired, so they didn't want to bring it in too early. And that seemed like a reasonable view. I think sociologists must have pushed that, but was it indeed the right thing in the end? Because figures do show, modelling shows that if we'd started a week earlier, we'd have had less cases, less deaths. But in the end, the virus is still there, and we will get a second wave. What we've had to do in the meantime is learn about it, be prepared for it, and then be able to act in a more knowledgeable way afterwards. So we know how to treat patients better. We know which patients to look out for, and there are investigations going on to try and find a blood test which they think they might have identified that will show which people will be more susceptible to severe disease, and in that way you can prioritize care to those people before they get severely ill. So yeah, I think we are going to get more surges. We are going to get told that we need to be more careful about staying away from other people, and we've just got to not get complacent. That's the most important thing, and I think companies can do a lot there to keep reinforcing the message at work that you must keep your distance and you must be careful with your hygiene.
Yeah, one of the things there that you said, I completely agree with, which was maybe a wee bit slow here off the mark to actually lock down. It was interesting for me. I was in Toronto the week before lockdown, and then I got an early flight back because things were just going crazy. But it felt for me over there that people were taking it a lot more seriously than over here. I got back actually, and I was quite taken aback how people were still very relaxed about it. My own family were very relaxed about it. They were all still getting together. Boris was being very relaxed about it, talking about herd immunity at the time. Yeah, and it's been a heck of a lesson.
I think people are looking now at events like the Cheltenham Festival, which was 250,000 people over those 4 days, about the Champions League football games where people from Italian supporters came over to Liverpool. They had Spanish supporters and Italian supporters in Spain as well, which may have been a spark for the bigger outbreaks that happen in these places. So we've learned a lot, but we're still in difficult times, and we still have to learn from those lessons and take those forward.
Thank you. Andy, I'd love for you to dive a bit deeper, if you don't mind, into why you think there's a gap between what employers believe versus what employees think in terms of offering reskilling and upskilling opportunities right now. Obviously, people are crying out for an opportunity to stay relevant, to not be replaced by automation, or to maintain their jobs over the next 6 to 12 months. Why do employers think they're doing a great job at ensuring that, but employees are saying the opposite?
Well, I think most employers probably were just relieved that they managed to kind of get something done. And in the main, most organizations were able to make that shift from a kind of physical location to a virtual working environment. So what I think we're seeing in the stats is something of a relief from leadership, which is, yeah, we've made it happen. We've given them the tech. They've got the kind of bandwidth, so they're fine. Not realizing, of course, that actually they probably didn't know how to use the tech. They were feeling incredibly stressed with the move, and they had long-term anxiety about their jobs. And of course, they're dealing with relatives who are sick as well. So I think there was a mismatch, or I think I'd say lack of empathy. And I have heard that what we need at the moment is more CEOs, chief empathy officers, who can actually sort of understand what employees are struggling with, and therefore can address those issues. What I think we have discovered, however, is how adaptable and resilient our people are. And I mentioned organizations that work on a trust culture rather than a track culture are more successful, because they recognize, look, I know my people will be productive. They'll be engaged if I just trust them and give them something of a sense of direction, but give them the freedom and the empowerment to set their working hours. So if they need to do childcare or educate their kids in the morning and then only work in the afternoon, evening, that's fine. We trust them to do that. We're not going to kind of force them on. So what I think it's doing is it's revealing the extent to which we do trust our employees to be adaptable and to get on with it, as in the main they have done.
Okay, thank you. Ryan, I'd love now for you to tell me a bit more about how HR departments and leaders can return those, can tailor those return to work plans that you're talking earlier. You're saying that that's based on up 15% in terms of feedback that they're offering at the moment. And I'd also love to hear from you a bit more about, I think you offered a stat, 94% of employees are proud, maybe it was at one particular organization, of how their company had handled the crisis. And you mentioned that transparency was a factor. What other factors made those employees proud?
Yeah, there's a few things to unpack there, Bill. I'll pick the last one up first. It was one particular organization, and then another organization that had high scores around people understanding why decisions were being made. And it was absolutely due to the way in which they were communicated with during this, and picking up on some of the things that some of the other panelists have been saying. That we're all adults, and people can take bad news, and people can, in a certain extent, people can deal with a bit of uncertainty as well, and have that resilience. But what people want to feel is that they are being given updates, and they are being given that kind of transparency around how the organization is being impacted, how they're potentially going to be impacted. And all that I was showing through that is that we've seen that where organizations have been doing that, and they've been doing that really well, and they've been doing it with empathy, again, to reinforce what Andy just said, that they're still seeing such positivity coming back from their employees, even when they're in the middle of such tough times, because their employees understand it. But they also feel like they've got a certain amount of control as to how they can influence it, and they've got that opportunity to have those conversations and feedback how they're feeling. In terms of what HR can do moving forward, what they have been doing with regards to return to work, even way before COVID hit, I've always been quite frustrated with typical like employee engagement surveys, and in the sense that they fail to often ask the questions that really matter to people, and that really resonate with people in terms of the specific role that they do and specific things that are impacting them in their role. But also we too often look at that type of data by things like gender or age group or length of service. when, you know, we need to understand personal kind of motivators and what drives individuals and what they want and need from an employee experience. And the reason I mention that is because now we are seeing organizations doing that as a result of COVID. So how they're doing that through the return to work surveys, they're wanting to understand more around individuals' living status, also how they travel into work, whether they have childcare or other care responsibilities, the types of things that we wouldn't usually ask before. We're now seeing that those types of questions being asked as part of surveys so that we can actually tailor the return to work or the employee experience in a way that's going to work for people. So rather than saying you might potentially have two people inside your organization that do the same role, that are the same age, that have been in the business for a similar period of time, one might live a 1 hour bus journey away and have 2 children that they look after on their own. And the other individual might live on their own and be 5 minutes from the office or the site, the HQ, and drive a car. So the return to work and the experience for those 2 individuals needs to be massively different. And so what we're seeing now is, as a result of this, organizations are starting to look more around how they can personalize and tailor their experience so that it works for individuals alongside their personal circumstances and specific situation that they find themselves in. And I'm hoping that that's going to be one benefit that comes out of this, that in the long term, we continue to look at the employee experience in such an individualized way, the way Gethin's been talking about as well.
Okay, thank you. I think we're getting questions in the chat box as well as in the Q&A here. Audience, if you could please try and put them in the Q&A, that's just going to help me try and filter these back to our panelists. We've got a question here from Christine. When it comes to monitoring and tracking contact paths, how can we turn a fear of privacy with tracking into a conscious decision to help the good of humanity? A bit of a libertarian question there. Let's throw that one out to everyone.
Well, I mean, I'll jump in first with the track and trace. It's very important that we have that available because, you know, in a place like South Korea, which has handled this very, very well, that there isn't such a privacy concern, or people aren't able to hold on to privacy. They've used credit card interactions, they've used CCTV and found out exactly where anyone's been. And there was a recent case of someone who went to, I think, 5 bars and nightclubs in one evening, and there were about 110 infections as a result of those visits. And there were 65,000 people traced by their trackers who could be in the vicinity. So it's very important that we do that. But I think a lot of this is down to the apps that are being brought out. And there are 2 apps. There's a private app that stays within your phone. And then there's another app which sends information back to the health authority so they can coordinate where these outbreaks are happening and respond quickly. And I think that the problem is being able to persuade people that that's important. And I think in this country, the theme is to link it to the NHS, which is, you know, well thought of at this moment in time because of the way people responded. And that will hopefully encourage people to use it, because you need human trackers. So you need people ringing up and persuading people. I can't tell you who, but you've been in contact with someone who's confirmed positive. We need you to do the right thing for society and stay home for 14 days. It's just a hard thing to ask someone to do, but you need that trust. And I think that there's not going to be a penalty for people not doing it, but you just have to say it's what you should be doing. And with the app, again, people are trying to be convinced that it's important that we have that to help trackers. It can work without, but it works better with the app. Sorry, Gethin, go on. You're next.
My hand up like I'm in school. But, I think what's really interesting is there is a foundation to any well-being, and I think that's trust. So one of the things you see quite a lot is workplace well-being won't work no matter how much money you spend on it if people don't trust their employer. Now, when you look at the Edelman Trust Barometer for the last 2 or 3 years straight, so that's measurement in global institutions and how much people trust them in about 53 different countries. And globally, 73% of people now trust their employer. So the most trusted institution in the lives of employees is their employer, far above the government, far above politicians, far above big business, media. And I think that's really interesting for us to kind of take note of in a well-being context. But I think where we are at the moment is we've understood that this data is a commodity, right? It has a value. We've understood from Cambridge Analytica and Facebook that people want our data because it's worth some money. And do we have the trust in the government? No. The latest research tells you that less than 50% of people currently trust the government. And so I think it's, what agents have got to say. And I think if we had done all the things we should have done to put a basis of trust in place, people would be downloading that app a lot more than they would. Personally, I wouldn't be touching it with a barge pole, and I haven't really become that conscious of how my data is used until fairly recently. But I think there's a lesson there for employers around that trust has to be there. And I think if you look at some of the apps that you can download from some of the big consultants firms where all your data is captured and you get this personalized wellbeing experience, the flip side of that is, do I want my employer to know that I'm at risk of heart disease? And will that stop me getting a promotion because somebody thinks I might have a heart attack in the next 10 years, or I'm not going to be healthy to do that? And I think so there's a lot in there. And I just feel like there's lots of stuff we could have done years ago that would really help us now. So there's some lessons to be learned for employers there as well, I think.
Okay, thank you. We've got a couple more questions here. We've got about another 10 minutes or so before we're going to wrap up today, everybody. So if you do have questions for our awesome speakers, please do get those in as soon as you can. We've got a question from Anonymous. They don't like to be tracked. Given the current situation and the lessons it may be teaching our children and the young adults, e.g. the lack of social interaction, what should we be doing to prepare for those guys, that next generation that's coming into the workplace, and how can we support their needs?
I mean, just my first initial response to that from me, maybe a philosophical one, is that I don't just think it's because of this current situation that we need to do more inside the education system to change expectations, or reset expectations of what work should look and feel like. Because it's absolutely those younger generations that when they're coming into the workforce, they should be challenging a lot of these cultural barriers and blockers to great employee experiences, which we've, as practitioners, been faced with and we've been addressing and challenging over previous years. So I think this is just another one to throw into this, how we make sure that we continue to enable really strong social health and social connectedness between people. And to encourage that. But as I mentioned, I think there's lots of expectation setting we need to be doing as part of the education system to really encourage future generations of the workforce to really think differently around what work should look and feel like, what good leadership should look and feel like. Again, to pick up on some great comments that John's been putting in the chat box over the past 20 minutes or so.
It's a shame that we don't have a Gen Zer on this panel as well today, because my understanding from Gen Zers, going back to what we were chatting about a moment ago, is they've been brought up their entire lives with online tools and being in the digital world, and they're kind of used to being tracked, perhaps more than millennials or previous generations. Lesson for next time. We'll get a Gen Zer on the panel as well. Okay, we've got a couple more questions that have come in here. Let's see. This one is from the fantastic John Ingham. Ladies and gentlemen, I interviewed John just a couple of days ago, actually, on the HR chat show, so that one's going to come up soon. He is a luminary and a very clever man. This is for Andy. Andy, my suggestion for dealing with these issues, are Zoom fatigue, etc., is more use of asynchronous communications technology. What are your thoughts, and what are IBM doing on this?
Yeah, and I've actually put a sort of a more structured answer in the Q&A on that. John, it's a really good question. I think in the new world, we need asynchronous, near synchronous, and synchronous technology all available in parallel at the same time. So so at IBM, we would have a full suite of tools, and we recommend the same for our clients. So things like email, obviously, are going to be going to continue, but increasingly, I think we're going to be using less of that. Zoom is very synchronous, and I think one of the challenges is too synchronous. You actually need downtime. All of us are completely exhausted because the amount of synchronous complex brain processing we're having to do. So I think other tools like that, like Slack or some of the instant messaging, which are sort of near synchronous, but also some of the other tools where we don't just sort of participate in a call like this, like Zoom, things like Trello and Mural, where you can kind of collaborate and be participative and active in a session like that. I think that's going to be another tool to use. But I think we're also going to need to create technologies that allow us to work on our own and have thinking time on our own without the noise from other people. And again, I don't think we've sort of designed, as it were, the quiet office space environment in the technology world that allows us to think and be creative and do the work that we used to do on our own.
Okay, thank you. Christine has come back with another question. Do you think we need to rewire our thoughts with the health insurance world then, if we are to create a better understanding of health status disclosure? In other words, should we rewrite the requirements for health insurance policies in order to facilitate a change in social well-being, as a ripple effect? Gethin, do you want to tackle that one first?
Yeah, so I think that change is coming, right? And it's already in place. So those insurers want to know more about you, because it's like fitting a black box to your car, right? It kind of gives you a much more accurate sense of that individual's well-being and what their kind of risk profile is. I think where it becomes more interesting is if you imagine somebody in their 20s who can kind of have a DNA test done that will give them an idea of their propensity to get certain illnesses or have kind of be very open about the family history and that kind of stuff. So you're focusing people on preventative. That feels like you're flipping it a little bit. So you're not punishing people because they have a certain lifestyle. You're still encouraging healthy behaviors. And I think that's where the secret lies. So it's almost like we see people like Vitality Health and people like that who are giving you lower premiums if you can prove that you go to the gym regularly. That feels like a much more positive spin than actually kind of punishing people for having a genetic disposition or living a particularly unhealthy lifestyle. And I think, from when I did my degree in psychology, it was all about that kind of reward was always much more powerful than the punishment element of it. So hopefully I think that's the point we'll get to, is just encouraging more healthy behaviors rather than punishing unhealthy ones.
Okay. So the bigger the biceps, the less you pay. Is that what you're saying?
Well, there's a big difference between physical health and aesthetics health. There are people people with six packs who have failed BMIs, so it's kind of, it's very different. But I think that's it. Then also goes into that whole holistic well-being, right? So the fact that my physical health might not be important to me at the moment, my mental health, like most people at the moment. I probably put on a bit of weight during lockdown, so I've actually been kind of dieting for a week. But inevitably there'll come a point where it might be my financial well-being, it might be kind of the community well-being. That's become a really big thing we've seen over the last couple of months. So I think it's recognizing that our well-being is lots of things. And it's interesting, you look at health insurance and income protection claims. Over the last couple of years, income protection claims in this country have completely shot up. And now the most popular reason why that will pay out is for mental health issues. So it was a benefit that we always thought was about physical illness. And not many people still realize that if you're struggling with your mental health, you can make a claim under your income protection and get all the support associated with that. And you're actually far more likely to get support through that method than you are going to the NHS because of the underfunded, under-resourced nature. So I think it's understanding that there is big health rather than just physical health. And we've been, 120 years since Freud linked the two. So Sigmund Freud obviously realized that the physical health impacted mental and vice versa. So we've got to take that whole view, I think, rather than just one element of that.
Okay, thank you. We've got about 3 or 4 minutes here before we wrap up. John Ingham is back with another question. And as a follow-up for Andy, you guys just having your own dialogue here, I think, and others, he says. Okay, what about technologies for helping develop social connections, providing the human touch we used to get in the office and may not be able to get in the future if we have to stay further apart? And this is huge, actually. This is something that I wanted to bring up with you guys as well. It's a bigger question about how can we ensure that we maintain a company culture, we have camaraderie within a team if only certain team members are allowed into an office at any one time, or we've got to sit further away from each other, or if some are working remotely and others are in the office. I don't know, I'm just throwing a bunch of extra things into John's question there. And
yeah, so
I think that starts with you, Andy.
Yeah, so a couple of quick things, and I'll try and be quick. So firstly, I think we're going to develop practices where we have meetings via Zoom or WebEx that are social gatherings. Now, I know organizations have been playing around with this. They're trying to have, like, virtual lunch breaks, or they're having, evening drink sessions or quiz nights. So these are early experimentations where companies are saying, how can we meet and be community without doing work? And again, I'm sure some are going to surface and remain. Others will just be ditched. But in terms of technology, I think this might be the time that organizations are going to start to explore more real technologies like virtual reality, or do you remember Second Life? Remember when people were playing around with sort of Second Life avatars? Well, that may be the time when we're going to kickstart that again. And does that give us a greater level of connection and personalization than before? Personally, I can't quite see it. I mean, I could dress myself up as a weird avatar in Second Life. Does that enable me more to connect with others? But I don't know. I think this is going to be a time, John, of some really interesting experimentation, and some things that we perhaps can't envisage will stick as being part of this new normal.
It's like a personal take on that. I think it's a great question, John, and it's almost one where you can see that, of course, organizations are going to want to experiment with things and look to try and develop the technologies to do exactly that. I just wonder whether we actually want that. We want that to be the future, in the sense of technology can be quite addictive. I'm already finding so many of the Zooms that I'm on could easily have just been someone picking up the phone to me, rather than it necessarily needing to be a Zoom. So technology can be quite addictive. And I'm just wondering if we develop something which is almost kind of designed to try and mimic that human connection, whether it'll end up actually kind of preventing people from having as much kind of face-to-face time as we know as human beings we need. And I guess my own personal stance on it, again, is I don't ever think it's going to be, you'll ever be able to properly replicate that kind of human touch you get from the face-to-face. And so I always look to what's the potential benefit of technology, but without taking it too far to the point where it actually becomes a negative, and it actually becomes where, because it's made to be easy to actually stay apart from people, we might actually get too drawn to that technology. I suppose there's a similar thing with the dating apps. People might potentially go out and speed date or talk to people face to face less than they might have previously, because they know that they can just jump on an app on their phone and superficially judge someone on that kind of basis. So I think with technology, there's always the opportunity, but there's that kind of dark side to it as well. And I just would like to see us make the kind of right decisions and focus our attention and efforts on the right types of technology.
And with that, everybody, I have to now say we've come to the end of this first UK InnovateWork virtual event. I'm sorry if anybody else had any more questions, but this is going to be the first in a series of events that we're going to be doing in the UK. We've got some events coming up. Actually, we've got on the 22nd for our Aussie audience, join for an even bigger version of the one which happened just about a week and a half ago. And then we're back on the West Coast in early July, and watch this space for the next date in the UK. But that just leaves me to say for today, Gethin, Andy, Ryan, Adrian, thank you so much for being speakers and being panelists today.